Imagine the world's deadliest killer. It's not a dramatic poison or a sudden plague. It starts with a simple cough. Then you get tired, you waste away, slowly, poetically. For centuries, this was the reality of the world's #1 cause of death. Tuberculosis, also known as consumption. And here's the scariest part. We had absolutely no idea how to cure it. So, in a world without antibiotics, when the doctor's best advice was basically good luck, what did humanity do? We got weird. We got really, really weird. Let's start with my personal favorite cure for this deadly lung disease. Cows. Yes, cows. One of the most popular treatments was for a patient to move into a cowshed, to spend their days and nights breathing in the fumes from the cows and their manure. The leading medical theory was essentially farm smells. They believed the ammonia in the air had a therapeutic effect. The cow was just an unimpressed, four-legged pharmacist. Didn't like cows? How about a long, relaxing sea voyage? The idea was to get you out of the polluted city and into the fresh, salty sea air. Which sounds lovely, except you were often trapped on a ship for months, with a dozen other people who also had a highly infectious lung disease. The cure often just created a floating quarantine of the doomed. There was the grape cure, which involved eating nothing but grapes for weeks. And my personal favorite, being strapped to a special chair and spun around really fast to reorganize the contents of the chest. It was a time of pure, unadulterated medical guesswork. But here's the most incredible part of this whole story. Amidst all of this desperate, bizarre nonsense, they accidentally stumbled upon something that actually worked, even if they had no idea why. It was called the climatic cure. The idea was to move patients to high-altitude sanatoriums, bright, clean buildings in the Swiss Alps or the dry deserts of the American Southwest. And for the first time, people started getting better. We now know why this was so effective. It was a perfect accidental combination of factors. First, the constant exposure to sunlight. The sun's UV radiation is a potent killer of the tuberculosis bacteria. Second, the enforced rest and plentiful food bolstered the patient's own immune systems. They had accidentally created the perfect environment to help the body fight back. So, the final verdict. Were the consumption cures weird but well? The desperation, the creativity, and the relentless search for an answer in the face of a terrifying disease? That is profoundly well. The specific cures, like the cow sheds and the spinning chairs, that is some of the purest weird in human history. But the accidental discovery that sunlight and rest could save lives is a beautiful reminder that sometimes, even when we're completely lost, we can stumble into the light. If you're as grateful for modern antibiotics as I am, you're in the right place. You know what to do. What modern medical marvel are you most grateful for? Let me know in the comments.